name's Bart Warner. I'm 69 years old. I have wet and dry macular degeneration. I had no idea what that was 3 or 4 years ago. Did a thorough examination of both eyes. 5 hours later, I got my first experience with a shot in my eye. I kept studying and networking around, and I found that there was a friend of mine that had heard about this treatment by a doctor in Riverside, California, that had been treating people with dry and wet macular for 20 years. So I got hold of him, made an appointment, got on a plane, and went down there and had my first laser treatment. To have to fly down every 90 days for this would be awkward and inconvenient. So I started asking around, thinking about what other ophthalmologist I could get to maybe learn how to do this treatment. And it was Matt Ward, and Dr. Matt Ward. And when I came down, I said, "Do you treat or see people that have dry or wet macular degeneration?" He said, "Absolutely." "So what do you do for them?" I said, "It kills me because there's nothing I can really do for them." And said, "What if there's a treatment that would do something for them? Would you be willing to look at it?" He said, yeah, he'd read some things. So I started sending him whatever information Dr. Luttrull could give me, and the information I'd read. And he didn't say no.
My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. I've been doing vision protection therapy in my clinic now for 2 years, and it's been really a wonderful experience to finally have something to offer my macular degeneration patients who are frankly desperate for something that's effective and proven to reduce their risk of progression in this terrible disease. My first introduction to macular degeneration was long before medical school. My grandfather had macular degeneration and lost most of his vision in his later years. And as a teenager, I remember seeing him struggle to read. He would listen to audiobooks. It also affected his mood. He had quite a bit of depression, and toward the end of his life, it was extremely difficult. I've seen this mirrored in my patients as I've become a physician and treated patients with macular degeneration, how it not only affects their functional abilities, it affects their emotional and several other parts of their life as they face the prospect of going blind. I was first introduced to the use of modern retinal laser therapy for macular degeneration that's become known as vision protection therapy by a patient wanting someone to do this for him in Utah. I have experience with retinal lasers, actually a cornea specialist by training, so I do a wide variety of things other than retina in my day-to-day practice, but I was intrigued by this option and was skeptical, frankly. I discussed with several of my retina colleagues who had heard of the treatment but didn't have much experience with it. I also started reading a lot of the papers that have been published by Dr. Luttrull and others to find out what was behind this treatment, what was the evidence suggesting that it works, and ultimately went to Ventura and spent time with Dr. Luttrull, training with him and learning from him regarding how he treats his patients. I was very impressed by his 20 plus years of experience with micropulse technology, his approach, and his data, thousands of patients over many years, showing real-world clinical proof that this is an effective therapy to reduce risk for progression to wet macular degeneration. These experiences and my patients essentially demanding it motivated me to start vision protection therapy in my own clinic.
As far as the treatment that Dr. Ward and Dr. Luttrull does, there's no pain involved. They give you a numbing drop. They put this gel in your eye. They hold the eyelids, and they put this ocular lens on so they can see into the back of the eye. So they know where to give the laser treatment. takes about 2 minutes. Again, after you've had 1 or 2 of these, it's no big deal. I have both eyes treated every 90 days.
After starting laser therapy for macular degeneration in my clinic, I realized that really immediately it was pretty clear that this not only is a preventative procedure, but there is a percentage of patients that see better after vision protection therapy with the micropulse laser. I never tell patients that they're going to see better. I tell them this is not the point of the procedure. The purpose of the procedure is to prevent progression of macular degeneration. But I can tell you there's a clear benefit to vision in a population of patients. Even after my first day of using the laser, I had patients that I called afterwards that were saying, I'm seeing better. I'm actually seeing things I haven't seen in years. And it's not 20/20 vision, but it's enough that these patients who have suffered year after year watching their vision get worse, it's life-changing for them to all of a sudden have something that's actually improved their vision in some circumstances. I've had patients in tears at times telling me what a difference this has made in their lives. And not only noticing some vision improvement, but also just that the fact that they can trust that there's reduction in the chances of them going blind over their lifetime.
And I sleep a lot better at night knowing that I have a chance to have this thing help slow down this progression so that if I live another 20 or 30 years, I'll still be able to see.
My name is Dr. Matt Ward. I practice ophthalmology at the Riverwoods Eye Center in Provo, Utah. It's easy looking at something like this to be skeptical. It's easy to look at this treatment as on the fringe or maybe not something that others are doing. That's totally understandable. I think any significant change in medicine in general, there's a lot of resistance early on. My experience, just in the beginnings of this movement, is that this has the potential to change millions of lives. I mean, this is the single greatest cause of vision loss in the developed world, and our population is aging at a rate we've never seen before, and so there's huge need for this. I think as patients start to experience this, as doctors start to have their own experiences with this will be something that can become a worldwide movement toward preventative therapy for macular degeneration.